Hello and welcome back to MHP. Hope you're all doing well. Today we will be talking about social anxiety. Social anxiety disorder or social phobia is a medical condition that causes fear and anxiety when you're around people in social situations. People with social anxiety fear being judged or watched by others. This disorder is treatable with talk therapy and medication such as antidepressants. Social anxiety disorder, formerly known as social phobia, is a mental health condition where you experience intense and ongoing fear of being judged negatively or watched by others. Social anxiety disorder is a common anxiety disorder. If you have social anxiety disorder, you have anxiety or fear in specific or all social situations, including meeting new people, performing in front of people, taking or making phone calls, using public restrooms, asking for help in a restaurant, store, or other public places, dating, answering a question in front of people, eating in front of people, and participating in an interview. According to the DSM-5, there are a total of 10 diagnostic criteria for social anxiety disorder. First, fear or anxiety is specific to social settings in which a person feels noticed, observed, or scrutinized. In an adult, this could include a first date, a job interview, meeting someone for the first time, delivering an oral presentation, or speaking in a class or meeting. In children, the phobic or avoidant behaviors must occur in settings with peers rather than adult interactions and will be expressed in terms of age-appropriate distress such as cringing, crying, or otherwise displaying obvious fear or discomfort. Second, typically the individual will fear that they will display their anxiety and experience social rejection. Third, social interaction will consistently provoke distress. Fourth, the fear and anxiety will be grossly disproportionate to the actual situation. Fifth, the fear, anxiety, or distress around social situations will persist for 6 months or longer. Sixth, the fear or anxiety cannot be attributed to a medical disorder, substance use, or adverse medication effects, or another mental disorder. Seventh, if another medical condition is present which may cause the individual to be excessively self-conscious, example, prominent facial scar, the fear and anxiety are either unrelated or disproportionate. The children may also include the specifier that the social anxiety is performance situation specific, for example, oral presentations. A core feature of social anxiety disorder is that you're afraid of being judged, rejected, and/or humiliated. Social anxiety disorder isn't uncommon. Approximately 5% to 10% of people across the world have social anxiety disorder. It is the third most common mental health condition behind substance use disorder and depression. Are there different types of social anxiety? A person with social anxiety disorder can have a mild, moderate, or extreme form of it. Some people with social anxiety only experience symptoms with one type of situation, like eating in front of others or performing in front of others, while other people with social anxiety experience symptoms in several or all forms of social interaction. In general, the different levels of social anxiety include mild social anxiety. A person with mild social anxiety may experience the physical and psychological symptoms of social anxiety but still participate in or endure social situations. They may also only experience symptoms in certain social situations. Moderate social anxiety disorder. Not only is it characterized by a persistent fear and anxiety in social situations, it also causes distress and discomfort during social interactions such as meeting new people or speaking in public. Symptoms include excessive self-consciousness, fear of judgment, avoidance of social situations, and physical symptoms like rapid heartbeat and sweating. Extreme social anxiety. A person with extreme social anxiety may experience more intense symptoms of social anxiety, such as a panic attack in social situations. Because of this, people with extreme social anxiety usually avoid social situations at all costs. A person with extreme social anxiety is likely to have symptoms in all or many types of social situations. What is the difference between having social anxiety disorder and being shy, you may ask? Anyone can experience shyness from time to time. Having a social anxiety disorder consistently interferes with or prevents you from doing everyday activities such as going to the grocery store or talking to other people. Because of this, Social anxiety disorder can negatively affect your education, career, and personal relationships. Being shy from time to time does not affect these things. In general, the three main factors that distinguish social anxiety from shyness are: first, how much they interfere with your day-to-day life. Second, how intense your fear and anxiety are. Third, how much you avoid certain situations. And fourth, many people with social anxiety disorder don't try to get help or seek treatment because they think social anxiety is just a part of their personality. It is important to reach out to your healthcare professional if you're experiencing ongoing and intense symptoms when in social situations. It is possible to fluctuate between different levels of social anxiety throughout your life. No matter which type of anxiety you have, it is important to seek treatment because this type of anxiety affects your quality of life. Treatment for social anxiety disorder. Cognitive behavioral therapy or CBT, with an emphasis on exposure, can reduce symptoms of social phobia. Exposure therapy involves gradually placing oneself in anxiety-provoking situations and associating the feared stimulus with a response of relaxation or indifference. This is also known as systematic desensitization and is very effective evidence-based treatment of phobia, including social phobia. The DSM-5 notes that the temperamental qualities of fear of poor social evaluation and inhibition are risk factors for development for social phobia. Child maltreatment, including peer abuse, is a correlational risk factor for social phobia, but causality cannot be verified. According to the APA in 2013, there appears to be a genetic basis, though it can be speculated that social anxiety is also a learned behavior. According to ADAA in 2013, obesity has been identified as a risk factor in teens, as teens who are obese may experience peer rejection and develop social anxiety as a learned behavior. Well, that's it for today on social anxiety. We hope that our video helped you understand social anxiety better. If you or someone you know is experiencing social anxiety, do not hesitate to reach out for support. Thanks for watching. See you next time.
If you liked our content, like, share, subscribe, and press the bell icon to never miss an update from MHP.